Hi guys, welcome again to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar. Well, I have come back with the second part of the previous video, skin diseases in pregnancy. In the first part, we discussed the common problems which almost, I would say, 99 to 100% of the ladies they go through. Changes in their skin, changes in their vascularity, the capillary, the network, the hair, the facial changes, the cloasma, pregnancy mask, the changes in the nails, the brittleness, the gum bleeding, everything. So we discussed how piles develop, how we develop these stretch marks, the linea nigra, the stria gravidarum, everything we discussed, which is very, very common in almost all pregnant ladies. Now in this video, we'll be discussing specific diseases, specific problems of the skin which make you think that, oh my god, what has happened to me? Should I run to a dermatologist? And even sometimes the doctors, they get confused, why is this happening? Sometimes it might just flare up. There are 4 or 5 conditions which actually mimic certain typical skin disorders, but some of them are worrisome, some of them may cause problems in your pregnancy, but generally they are self-remitting. They just occur due to pregnancy, changes in the pregnancy, the hormonal changes, and then they go away as soon as the pregnancy is over. Okay, so we'll be discussing this today. Now before I start, let me just thank you all for the tremendous response we're getting to the channel. We're going to be a 1 million family very soon. There are 3 ways to consult me. Now because of the lockdown period, lockdown everywhere in India, because of lockdown, obviously the online consultations have actually boomed up. So I am there on DocWise app for the last 2 years. DocWise is an online application. Download it on your mobile's Play Store, insert my PIN, and then you can get a consultation from me, and that is the best way to consult right now, because you people are asking me questions and typing your questions everywhere on every social platform. Don't do that. Just use DocWise app and you'll get my answers. When I use super chat on this channel and the other channel, Dr. Sonal's Answers, you can use super chat, because when I go live, I select some of your questions, but then if you really want to have a private consultation, you want a private question to be answered, then you have to use super chat. And the third way, the best way would be, whenever the lockdown is over, come down to my hospital, that's the address, and that will be the best way to contact me. Okay, now coming back to the topic, skin disorders in pregnancy. Guys, I just want to tell you that there are certain skin conditions which may probably flare up if you already had that disease before and now that you are pregnant. For example, certain diseases which are related to your immunity, your ability to react to the environment, for example, atopic dermatitis, then certain tumors of the skin, cutaneous tumors, then fungal infections, because immunity during pregnancy comes slow, right? Even psoriasis, this is very commonly seen in patients who already have some skin problem and then they get pregnant. So during pregnancy, sometimes your skin problems might flare up and you really need some help from the dermatologist. Coming to the conditions which are specifically because of pregnancy, and they are called pregnancy related dermatosis, right? That is the common term given to them. So one of them, the most common one, is PUPP, that means pup. It sounds like a small little dog, but no. The full form of this is, it's quite a big name. It's pruritic urticarial papules and plaques of pregnancy. Difficult for me also to understand and remember, but that is it. PUPP, pruritic urticarial papules and plaques of pregnancy. Now this is very common. It generally happens in the 3rd trimester. Why is it happening in the 3rd trimester? Because it happens because of overstretching. So because in the 3rd trimester you already reached your 7th month, the stretching is maximum at that time. In the first 2 trimesters, the tummy does not come out that much, and in primigravidas, in the first pregnant, the ladies who are becoming pregnant for the first time, you're thin, you don't have much space in your skin is not that elastic. When it is your 2nd or 3rd pregnancy, you already have some weight on your skin and your skin has already undergone stretching in the first pregnancy. So it is generally more common in the ladies who are pregnant for the first time, or ladies who are having multiple gestation, twins or triplets, or ladies with lots of fluid inside, anything which causes overstretching of your abdomen. So it is more common in the 3rd trimester. The cause is generally excessive stretching. It is common because it is almost 30%, seen in 30% of the cases. It generally happens alongside your stria gravidarum, along the lines of those stretch marks. It does not go anywhere else. It does not reach your face. It is just like redness and pruritus, kind of pruritic rashes just along the stria gravidarum that you have developed. And the best way to avoid or to prevent further stretch marks is not to use your nails to scratch, because stria gravidarum as such gives you lots of itching, and I have already told you in many videos, do not use your nails to make them worse. If you make your stretch marks worse, they are going to definitely affect your cosmetic appearance of your skin later on, because you know the stria gravidarum, they will definitely become lighter as soon as the pregnancy is over. Within 3-4 months your skin will come back to normal. Some of the stretch marks will remain there, they will not go away with any treatment, but don't give yourself more stretch marks, more marks with the by using your nails. So just be careful. The treatment of every skin disease is almost the same, so we'll be discussing it towards the end of the video. So just be careful. PU/PP is nothing to worry about. You don't need to rush to the doctor. It is just normal. Just avoid over scratching, and it is not going to affect your pregnancy. It is going to resolve as soon as the pregnancy is over. Within 1 or 2 weeks it will be totally gone. The second problem that we are going to discuss today is prurigo of pregnancy. Now, as the name indicates, prurigo of pregnancy means you're going to have a lot of itchy nodules, erythematous nodules, like raised areas, just like eruptions, and they will be reddish. And this persists for longer period. Even after the delivery has happened, the pregnancy is over, it might persist for weeks together in the postpartum period. But first of all, the incidence is very low. It is very, very uncommon. I have never seen it. I would say 1 out of 300, that is 0.3%. So very rare, and moreover, it is not associated with any fetal risk. Your baby is not at risk, so nothing to worry. Yes, it is a bit distressing because it remains there for a couple of weeks, even in the postpartum period. You feel quite itchy. You have those rashes in front of in the front surface, not at the back, and these will just go away. Just be patient, and you just need to use certain anti-allergics or some emollients, some lotions which give you relief. That's it. Nothing to worry. Prurigo of pregnancy will go away on its own. Guys, next what we're going to discuss is pruritic folliculitis of pregnancy. Now, as the name indicates, pruritic means there is itching. Now, this particular problem does not actually associate with itching at all. It actually is not as itchy as compared to the other problems, but still the name is pruritic folliculitis. The main terminology is folliculitis. Now, what does folliculitis mean? Follicle is basically the base of the hair, the small hair, the tiny hair that you have on your abdomen. So wherever this happens, wherever the rashes appear, they appear like follicles. They appear like, I would say, pus-filled vesicles, like rounded whitish yellowish structures, and you feel that, oh my god, what is happening? Your doctor might misinterpret it as a bacterial infection. They might think that you're having pustules, and they might treat you with antibiotics. So there is no harm in taking antibiotics as long as the antibiotics do not affect your pregnancy. The dermatologist and the gynecologist should be aware that which antibiotic should be given so that it does not affect your pregnancy. And if they are experienced enough, they can diagnose that, okay, this is just sterile pus, it does not need any infectious treatment because it is not bacterial, it is simply pruritic folliculitis of pregnancy. Then they might just avoid antibiotics, and they might just tell you to use some topical steroid cream, which is enough. So basically, it just the appearance of this pruritic folliculitis is a bit dangerous, and you might feel, oh my god, do I have chicken pox? Do I have some disorder, some kind of pustules or pus-filled infection? No. It is just simply pruritic folliculitis. That is, it looks like pus-filled vesicles, and it will subside on its own. Believe me. Guys, the fourth disease that we're going to discuss now is already something which you must have heard already, because it is very common, and I've already uploaded a video on that. Can you guess? Well, that's obstetric cholestasis. That is intrahepatic cholestasis of pregnancy. I've already uploaded this video a couple of months back in English and Hindi both. You can search for it, and I had good number of views on that video and so many questions, because it is a very commonly seen problem, and I think people are very much aware of this. Now, why is this dangerous? Because it causes deranged LFTs. Your liver function tests, the enzymes, they rise because of the excessive hormone in your body, progesterone. It causes cholestasis. So there is little derangement of your LFTs already in every pregnant lady. Now, how do we diagnose whether it is dangerous or not dangerous? Now, it is very difficult just on the basis of blood test. So what we do is we see you clinically, we see how much itching you have. Generally, itching is common in pregnancy. There may or may not be a rash associated with intrahepatic cholestasis. If there is prurigo of pregnancy, which I have already mentioned, prurigo of pregnancy is sometimes associated with intrahepatic cholestasis. So basically, Intrahepatic cholestasis may occur in patients who have a genetic history, family history, or presence of HLA genes. So we don't know exactly the cause, and the problem that it is creating, that is again commonly seen in almost all pregnant ladies, because in every lady there is high progesterone, which causes cholestasis. That means your bile doesn't move forward, it gets collected under the skin, that causes derangement in your liver function enzymes. But again, you have to see which is disease, which is not disease, which is just a common finding. So if the patient is having rashes and having this itching, that is prurigo, and her LFTs are deranged, then we take it as obstetric cholestasis, because we do not want your baby to get affected because of this, because the outcomes of this particular disease is dangerous. The mother herself might have DIC, coagulopathies, bleeding disorders, vitamin K deficiency. The baby might undergo a premature delivery, meconium staining is quite common, and then ultimately intrauterine death has been seen in intrahepatic cholestasis. So I would suggest any kind of deranged LFTs with itching, with rash, run to your doctor, obey your doctor, get yourself checked every 7 to 10 days or even 15 days. Color Dopplers, CTGs, that is NSTs, have to be done, and the baby has to be kept under surveillance so that the delivery happens at the right time. Guys, the next disease that I'm going to tell you is again a very rare disease, but then it sounds very dangerous when you read about it, when you actually see that disease. I have never seen it in 20 years. Now that is pemphigoid gestationis. Pemphigoid gestationis, if you see the literature, it says it is seen in 1 out of 50,000 pregnancies. So that is very rare. But then the patients who actually suffer from this will definitely know that it is very difficult to actually manage this kind of problem, because it appears as if you have got herpes over your tummy. Now what is herpes? Herpes is a skin disease which has been seen to be associated with pemphigoid gestationis, because it kind of pemphigoid, what does pemphigoid mean? Pemphigoid means an autoimmune problem of the skin in which you get bullous vesicular vesicles all over your body, and because it resembles herpes, because herpes can happen anywhere, on the corners of your lips, in the genital area, or in near your eyes, or even on your hands or a tummy, wherever. So it has been seen to be associated with herpes gestationis. It has been seen to be associated with molar pregnancy and choriocarcinoma. Then with any kind of autoimmune disease, like for example Graves' disease, the thyroid Graves' disease. So any patient who's having autoantibodies, that means autoimmune disease, when your own antibodies start attacking your own body cells. So in that particular cases, pemphigoid gestationis is seen. Now because you develop IgG antibodies, IgG have a low molecular weight, they can easily cross the placenta, and it can sometimes affect your baby in the form that when the baby is born, you can see some skin lesions on the baby, just like you had. The bullous and vesicular eruptions can be seen. Sometimes, very rarely, it may cause placental insufficiency or premature delivery, because it might accumulate in the placenta and cause some problem. So it is your doctor's duty that if you are suffering from this disease, then you should be you should undergo a proper continuous surveillance so as to prevent any complication in the pregnancy. Guys, last disease that we are going to discuss today is impetigo herpetiformis. Now the name is a bit absurd, difficult to pronounce, but herpetiformis, well, it is kind of psoriasis. You know what is psoriasis? Psoriasis is very commonly seen in many people. Some parts of your skin, they become dry and scaly, and they're quite itchy, and you feel that your skin is changing. Some particular spots, some particular patches might be there in psoriasis, and when it becomes pustular, when they feel as if they have pus inside, that becomes impetigo herpetiformis, and it is not very common, but it is seen in pregnancy. It is said to be more common in the second trimester, second half of pregnancy, and it kind of repeats in every pregnancy. In fact, any skin disorder, any skin problem that we have discussed so far, if you have had it in your first pregnancy, it is most likely to reoccur in your second or third pregnancy. And there are certain patients who are on pills, like oral contraceptive pills, who want to keep a gap between pregnancies, or who are just using pills for a long time. Such patients, if they already have some skin problem or already have a history of some pregnancy related skin problems, especially pemphigoid gestationis, they have a tendency to have this flare up of the skin lesion again and again because of the use of OCPs. Okay, so coming back to impetigo herpetiformis, now this is a typical disease in which you get systemic symptoms. You don't actually come to know, because there is no pruritus. You kind of have diarrhea, vomiting, fever with chills, nausea. Then you even might develop lymphadenopathy. That means the lymph nodes in your body might swell up and you feel, my God, what's happening? You might develop a secondary infection, you might develop hypocalcemia, your protein might go down, hypoalbuminemia, your parathyroid gland, which is just above the kidney, that might become overactive. So again, a disease which has many, I would say, subsets, and we don't exactly know whether it happens because of pregnancy or it was there already and it just became worse because of pregnancy. So you just need to be careful about the baby, because the last 3 diseases that we discussed, intrahepatic cholestasis, pemphigoid gestationis, and then this impetigo herpetiformis, these 3, there are controversial reports that yes, the baby might get affected. So your doctor has to call you for continuous surveillance so that we are making sure that the pregnancy is going fine and the baby is not getting affected because of this disease. All right, so now we come to the treatment part of all these skin disorders. So guys, why did I not discuss the treatment initially? Because all the kind of skin diseases have only typical kind of treatment. For your pruritus, for your itching, it is antihistaminics of any kind, cetirizine, loratadine, or any of that family. It does not affect your pregnancy, and according to the doctor's expertise, according to the doctor's experience and your recovery, how you are responding to the treatment, the antihistaminics might differ. Coming to the local creams, we do not use vitamin A creams at all, whether it's oral or topical. We just don't use it because that is dangerous for the baby. Otherwise, any kind of other cream, topical cream, it does not get absorbed so much in your body that it is going to affect your baby. So all the steroid creams are safe, and generally your doctor will give you some high potency or low potency steroid cream depending upon the condition that you're having. Sometimes, very rarely, if you're not responding, you're having a lot of problem, you might be put on some oral steroids in the form of prednisolone, and then the dose might be tapered off. Now, generally these things happen in the 2nd or 3rd trimester, and your baby has already grown, the organs have already formed. So even if you take 5 to 10 doses of steroids, because you're having lots of symptoms and the doctor wants to give you some relief, it doesn't really matter, it doesn't really affect your pregnancy, so don't worry. So in case your doctor puts you on oral steroids, it's okay, but the doctor will definitely avoid it in the initial treatment. And last but not the least, you might be put on some antibiotics. All the antibiotics except for some which are group B, group C drugs, we do not use them in pregnancy. Otherwise, all the antibiotics are safe, especially in cases where you're having secondary infection like impetigo herpetiformis, or I discuss one more thing, pruritic folliculitis, in which you get pus-filled structures, vesicles. In such cases, the doctor will put you on some antibiotics for your relief, and that is absolutely safe. So don't worry about that, and I hope you like this video. If you liked it, please click the like button, share this video so that maximum number of people can take benefit from it, and do not forget to subscribe to the channel, because we are already going to reach 1 million very soon. And if you have not clicked the bell button, please ring the bell button, click on it so that you come to know at least whenever I upload my new video, you'll get the notification, right? So take care guys, bye bye, see you soon.